Welcome to the pharmaphorum podcast. This is web editor Nicole Raleigh, and today I'll be speaking with Jeff Harper, who is head of product at IntelliGuard, about the pressing issue of rising drug costs and what hospitals can expect heading into 2026. Welcome, Jeff.
Hi, how are you?
So, IntelliGuard's modular and scalable medication management systems support a broad category of critical pharmaceutical inventory and supplies, tracking medications via radio frequency identification and improving inventory management and optimizing labor use. But to kick things off, Jeff, I was wondering if you could introduce yourself briefly for listeners.
Yeah, sure. So I'm Jeff Harper. I'm the head of product here. And, my background is in healthcare and health system software. So I grew up kind of in the mobility space and supported some of the largest health systems and children's hospitals in the U.S. With tools that their patients and providers use to both receive care, deliver care, make themselves healthier in the process. And we also built a lot of software for organizations ranging from Wolters Kluwer to the FDA and others in that process. Went up through venture capital and private equity, grew a company, and then ultimately sold it. Advocate Aurora Health was one of my clients. And so I kind of jumped at the opportunity to join a large health system. They promptly merged with Advocate Health. And then, so ultimately I became the entrepreneur in residence and kind of led digital innovation for Advocate Healthcare, which was the largest health system in the United States. Did that for 3 years and really enjoyed working closely with the care providers and all the things that we were doing, but kind of missed innovation and digital opportunities for growth and building products. And so, a friend worked in strategy here for IntelliGuard and reached out to me. And so after a brief period of time of talking about the opportunity, got really excited about coming to work here and helping us as we advance.
Thank you, Jeff. So the rising cost of drugs in 2025 is driven by several factors, including inflation, supply chain issues, and the demand for specialty drugs. The average annual drug spend per capita in the US is approximately $1,500, indicating a significant financial strain on both employers and employees. The UK government, meanwhile, has implemented measures to manage the cost of living, including a freeze on NHS prescription charges to ensure patients have access to necessary care without financial burden. However, the overall trend suggests that drug prices will continue to rise, impacting the affordability of essential medications for many individuals. But I want to ask about the effect on hospitals, Jeff. How are rising drug costs and shortages straining hospitals today, and how will this intensify possibly into 2026?
Yeah, it's a great question. As you mentioned, the economy globally and in the U.S. is, you have inflation, and then you also have just the changes and the nature of medications and how we think about drugs as we get more and more specific in the types of medication we provide to patients. And so that will continue, and we can see that trend. And in some categories of drugs, it's increasing substantially year over year. And so, at the same time in the U.S., we have providers being squeezed as well, which, I'm sure is a global impact, which is, with insurance and costs, as you mentioned in the UK, the amount that you can charge for the care is decreasing, while at the same time your cost of care is increasing. And so both of those, really create a lot of questions and concerns as we think about profit margin or just even ability to operate in the ways that you want to. And so, both of those factors are compounding, and what we're seeing, and, I saw it when I was at Advocate, and I'm seeing it first here as we talk to our customers all over North America, is providers have to change. And so they're having to rethink their businesses. And this isn't a new situation. I think we've seen this across healthcare over the past 10 to 15 years where, just the industry is changing, it's evolving, and all these organizations have to move and grow with it. And it's forcing them to innovate or, adopt new practices that help them to manage care, manage the delivery of of the services they're providing to those patients in new ways to be more effective over time.
Absolutely. So if we think about these notions of evolution and adaptation and change, what role could digital health technologies like RFID and predictive analytics play in addressing drug waste and, as we've been discussing, ensuring access?
Yeah, I think it's important when we start to talk about this to say that there's certain stable table stakes for healthcare, right? And so obviously our primary concern is health outcomes, patient safety, delivering the best possible care that we have to those patients. So you leave that as a table stake and say, of course we're going to do that, right? That's our mission, and that's always going to be the primary focus. However, now we have to figure out how to run a business that's more effective, that's more impactful, that's more efficient. We have to take steps that maybe industry or kind of private commercial businesses have had to do for years and years to adapt new ways of looking at things like inventory. And so as we think about RFID and predictive analytics, I try to demystify these things when both I talk to our company and to our clients, which is this idea that, when you can put a tag on a medication and I can know exactly where every vial of medication is throughout my health system, right? And most of these organizations today are massive and have tentacles of where care is delivered in all these different places. So we're putting meds everywhere. And when we know where they are, and when we can predict utilization patterns, when we can predict what we need to order, replenishment, and all the different pieces that play a role in managing and essentially controlling a more efficient and effective inventory, we can run a better business. We can run a more impactful business. So again, we're not going to do anything that would jeopardize care, but when we carry less inventory, we carry the inventory that we need to deliver care and maybe even a little extra to ensure we can cover unforeseen needs. We then can more effectively spend our money and more efficiently run our businesses. And that creates massive savings in some of the organizations that we support.
So it's a bit like a business reframing, if you will. So my next question would be, why are hospital CFOs and pharmacy leaders reframing medication management as a strategic priority, as you've been saying, not just an operational one there?
Well, I think it's a strategic priority at a number of levels. And you start with this idea of shortages. And so shortages mean if we're wasting medications that already have a shortage, it could impact care delivery. So again, that's always, to me, the place where you start. So strategically, if we want to deliver the kind of care that we believe to be leading in the industry, we need to make sure we always have the medications on hand and not just the ones that are easy to come by, the ones that are sometimes more difficult. So from a strategic perspective, that then becomes paramount, and more efficient utilization of those medications is a big piece of how this is delivered. Strategically also, not just in the US, but globally, the kinds of places where care is delivered are changing. And so we're seeing more care delivered in clinics and not just in the hospital. And so as we think about the strategic delivery arms, the places in which care can be delivered, they can be lower cost places that are higher impact. We can bring care out into communities. And that means we need tools that will still allow us to provide the same level of support and operational delivery into those new ways as we have into the high value hospitals of the past. We'll still have those in the future. We'll just have less of those. And so strategically, we need to make sure that we can deliver, again, that business, that care delivery in the ways that we need to be impactful.
Thank you, Jeff. So when it comes to medication stewardship, I was wondering if you could explain for listeners what the notions of control and transparency really mean.
I think they probably mean different things to different people. But to the clients that we're talking to, you start with transparency. So it's the idea that I know where all my meds are in the real time. At this very moment, I know exactly where every medication is. And that's what RFID allows me to do. It can see across the ecosystem of where I deliver care and where that is. So when I have transparency, I can then do control, which means I can practice safety precautions. I can practice inventory management to ensure I've done everything I need to do from a regulatory perspective. And it also means I can more efficiently run the business that I need to support the inventory needs of every place that I deliver care.
Absolutely. So final question for you. What thought should listeners be left with to mull over, given everything that you've been discussing with me today, when it comes to drug costs as they are today and drug costs as they could be in the near future?
Well, it's an interesting question. I mean, as not a drug manufacturer, there's only so many things that we can impact in the role that IntelliGuard or that I play essentially in that role. But as a listener, I think you want to make sure that you have the most efficient and effective industry as possible, because cost has a number of impacts. One is cost could be the kind of care that you can receive based on where you are or the types of, insurances or other provisions that you're provided. Drug cost will impact the availability of medications, and it also impacts, how we really think about the kind of care that we're delivered. And so we really need to all lean into creating the most efficient, most effective system in all of our local areas, but also globally, because all of these impact, our health and well-being over time.
Absolutely. Here's to collaborative leaning in. Thank you very much, Jeff. It's been a pleasure.
Thank you.
And that concludes another episode of the pharmaphorum podcast. You can find more information about this episode, including a download link and information about previous installments at pharmaphorum.com/podcasts. The pharmaphorum podcast is also available on Apple Podcasts, Spotify, Overcast, Pocket Casts, Podbean, and pretty much wherever else you download your other podcasts from. Just search for pharmaphorum and follow and hit subscribe. Of course, don't forget to visit our website itself, where you can sign up for daily and weekly news and analysis bulletins. And do follow us on Blue Sky and LinkedIn at pharmaphorum. That's all for now. Thank you for listening.